Love music, love life. You are listening to Soul Food on Smooth 98.1. And here, we not just love music, we love a good quality of life. That's why we have this education and all this conversations that we have every Saturday morning from 8 till 8:30. We call the show Soul Food, and you're welcome to join the conversation. Today, we are talking about upper respiratory tract infections. What are the causes? What are the treatments? How do you prevent them? What are the risk factors? So for the next 30 minutes, that's what we will be finding out. And I will not be doing that alone. I do have a returning guest who I am grateful for her presence this morning. Everywhere she goes, she spreads the gospel of health education, and she is very much at the center of public health, making sure that people make better decisions that touches their health and wellness with the information and education she provides. So please welcome with me Testimony Adeyeye. Good morning.
Good morning, Sean. Thank you so much for having me once again. It's a pleasure
Thank
to
you
be
for
here.
joining me bright and early. And how has it been spreading the gospel of health education?
Oh, well, very well. Very well. It can be very demanding, but yeah, we are at it and God is helping.
Yeah, well done. So let's jump right into it and understand upper respiratory tract infection. But before we get to the infection, let's know what constitutes our upper respiratory tract.
Right. So, upper respiratory tract is a subsection of the respiratory system as a whole. So, the respiratory system is divided into two. We have the upper respiratory tract and the lower respiratory tract. So, here we're talking about the upper respiratory tract, which comprises of the throat, yeah, the nostril, the nasal cavity, the larynx, the pharynx, and the sinuses. So those are the parts that constitute the upper respiratory tract.
Hmm.
Them
All
as
right,
well.
so let's talk about the infections that attacks
So
these guys.
yeah, so talking about the infection that affects the upper respiratory tract. So defining upper respiratory tract infection first. These are infections that affects, just as the word implies, upper respiratory tract infection affects the upper respiratory tract. That means all of those organs I've just mentioned, the larynx, the pharynx, the sinuses, the nasal cavity, the nostril, like starting from the nostril, which are these two opening in our nose. So all of those organs have been, when they are being affected by infection, by infectious agents, that's microorganisms to better put, right? That's when infection of the upper respiratory tract occurs. And majorly, the upper respiratory tract is affected by virus, right? Most of the infection that affects the upper respiratory tract are viral, although there are some bacterial infection that can occur at the upper respiratory tract. They're majorly viral. So we have examples, epiglottitis, the common cold that we are familiar with. We have laryngitis, we have pharyngitis, we have sinus infection, we have flu, like the general flu. Yeah, so most of them are viral infection, although some cases we might have bacterial infection.
Hmm. Now, before I go on to getting to understand the causes and the symptoms, will there be any truth to this? So I started before I brought you on. I said that it's not just Christmas that's in the air. It looks like we have sore throat, common cold, and all the likes in the air. And I say this from experience because I just got back on air 2 days or 3 days ago. My throat was really sore and it was painful. So it looks like we tend to have this repeat. It's like there are some seasons in the year or some months in the year that we have this more often. So can it be attributed to the weather? Because I do know a number of people who are going through the same thing.
Yeah, so sorry about that. My sister currently has a cold.
Ah, you see what I'm saying?
That's interesting because this weather particularly contributes to upper respiratory tract infection. So when we get to periods like this Harmattan period and then the winter period for those in the other parts of the world, it's attributed with dry air, right? And when there is excess dry air, there is tendency for the mucous membrane in in the upper respiratory tract to be dried up because of the extreme dryness of air. So when this occurs, the mucous membrane, which is supposed to serve as medium to trap foreign bodies from entering into the lungs and the other parts of the respiratory tract. They are dried up and they are not able to play their function. Okay, so let me just even say that the upper respiratory tract plays majorly a role of breathing and speaking. So the air we breathe in and the fact that air can go into our body through our nostrils and our mouths is a function of the upper respiratory tract. And also the voice that we project, so the voice that comes out of you, it's also function of a part of the upper respiratory tract, which is the larynx specifically, which is the voice box. So in dry season, in harmattan season, because of the dry air, the mucous membrane and some other parts of the respiratory tract, the upper respiratory tract, that is meant to filter air, that is meant to trap foreign body, including smoke, dust, and other pollutants, they are not able to play their functions as they should because of the dryness. And so those foreign bodies, they find easy access into the upper respiratory tract, causing some of these infections that we are talking about. Same thing, because of the fluctuation of the weather with regards to temperature. Yeah, so this moment is harmattan season, quite all right. But at some point, it's looking hot, extremely hot, right? Which is what we have been experiencing for some couple of days now. And then at some other point, it is cold, right? So there's a fluctuation of temperature, which also plays an effect on our immune system, right? So all of those imbalance have their role that they play on our immune system. And because of that, at some point, our immune system is suppressed, right? And then allowing the body not to be able to fight off infection when it should. So these are some of the peculiarities with this particular season we are in now and this upper respiratory tract infections that we're talking about.
Ugly, really ugly. Okay, so
Right.
I think you have mentioned the possible cause, which is virus, but generally give us an overview of the causes of this upper respiratory tract infection.
All right, so I can say that the causes of upper respiratory tract infection are majorly synonymous to the mode of transmission. Yeah, because so while we agree that they are majorly viral, right? So there is a way that the virus is being transmitted, and here we bring the cause of the infection, right? Basically, direct contact with infected persons, people that already down with upper respiratory tract infection, that have symptoms already, obvious symptoms, direct contact with them. It could be either touching them, especially for the fact that some people might not practice some level of hygiene, some level of etiquette, especially with regards to cough. Okay, so let me just talk about the symptoms because so when we understand that some of these things, the cause is attributed to transmission as well, we understand why we're saying this. So if some of the symptoms, for instance, is running nose and somebody is having a cold and is having a running nose and the person does not practice thorough hygiene, use that same hand to touch other people or touch surfaces and those surfaces get contaminated. Other people come and touch those contaminated surfaces, go ahead and put their hands in their mouth or in their nose, read their eyes, their ears, and all of that because they are interconnected, right? Those are some of the ways that all of these infections can come to play, right? And some of other ways are even just breathing the air. So peacefully, I am here breathing fresh air, supposedly, not knowing that it's contaminated air, probably because somebody has just sneezed into the air and the air is contaminated, especially as an infected person, just sneezed into the air or just coughed into the air without practicing cough etiquette. And then I'm here innocently just breathing the air. And then, of course, I can get down with the infection. So those are some of the causes of respiratory tract infection.
Thank you. So would it be safe to say that the risk factor also is mentioned already? I mean, maybe staying in the same environment with someone who's infected or not having enough ventilation or not washing your hands?
Yes, so some of the risk factors we already mentioned, like you said, congestion when you are in a tight environment that is not well ventilated, and then there are people that are infected in such environments. Yes, so that can be a risk factor. Poor hygiene can be a risk factor as well. Other risk factors includes weak immune system, right? So already, like we already established the fact that there's fluctuation of the temperature. Yeah, so which can have a toll on the immune system. So weakened immune system can also be a risk factor for upper respiratory tract infection. Some people already have some lung disease and some other respiratory issues, right? Can also be a risk factor for it. And of course, children, right? Age also. Children, I mean, when I'm talking about age, now I'm talking about children and older adults, like aged persons, right? Who have, for children, they have just developing immune system. And then for aged people that have already compromised immune system, so also can be a factor for upper respiratory tract infection. And of course, travel as well. So many people during this period of time when they travel and all of that, because of change of environment and then of course atmosphere, the air and all of that, those are also risk factors for upper respiratory tract infection.
Let's talk about the symptoms. I think you started, but we should talk about it fully because having a little bit of fever with sore throats might seem a little bit dramatic to me. Sore throat should just come on its own. Why is it coming with fever?
Okay, so yeah, for sore throat, symptoms generally. So we have fever, we have sore throat, we have cough, running nose, sometimes fatigue, right? Because it can come with headaches and the likes. Yeah, sometimes nasal congestion and all of that. Those are some of the symptoms that come with upper respiratory tract infection. And so when you think about it, you just feel like when I begin to have a kind of nasal congestion or maybe some kind of congestion in my throat. And then the moment you begin to have that or there is not like you cannot feel that clearness in your throat, and it may be symptoms like early symptoms of upper respiratory tract infection. Same thing with sore throat, right? So while sore throat is majorly attributed to laryngitis, right, because that's where the voice box is, we have other infections like epiglottitis also can lead to some level of sore throat. But in general, upper respiratory tract infection would get to clear off in some matter of days or even weeks by themselves. So we call them self-limiting infections. In other words, persons can overcome them by themselves, even without any specific or particular treatment per se. But because of the fact that sometimes, because of ignorance of what to do or how best to address some of these things, sometimes they elongate and then they become longer, they stay longer than expected. But if you look at it, most of the time, the duration at which people get to experience upper respiratory tract infection maybe between 7 days to 10 days, just 2 weeks at most. And some cases, it might extend to 3 weeks and then, okay, maybe it gets so severe and then you then need to consult the help of a medical practitioner or something.
So let's talk about that self-resolution. What's the typical duration of the symptoms and the time I have to wait for it to resolve? And if it's not resolving, what do I need to do?
Okay, so like I said, if a typical duration of upper respiratory tract infection can be within the space of 7 to 10 days. Some can be lesser, depending on how well the body is able to get over it in time. So like we said earlier, most of these things have to play with the immune system, right? So while the body has two levels of defense when it comes to the upper respiratory tract, right, with regards to infection, the first level of defense is the physical defense, which includes the air in our nostrils, right? The air strands in our nostrils, which we call the
Okay.
cilia.
Yeah.
Yeah, so the air strand in our nostrils help to filter microorganisms, help to filter dust, particles, and all of that. Also, the mucous membrane that I talked about earlier also helps to further trap microorganisms that have penetrated some way through the nasal cavity, right? So those are physical kind of defense, right? So when it gets to the trachea, the upper part of the trachea, yeah, we have the other mechanisms that are now attributed to the immune system itself that helps to also play defense to ensure that the body does not come down with this infection that we are talking about. So generally, if the immune system is strong enough, right, and these things get to infect the body, over time, there is a way the immune system can easily combat these microorganisms, and then in some matter of days, some people are free from the infection already. but maybe in some few cases, and it elongates than necessary. So the person now begins to wonder, okay, so what can I do? What do I need to do? Or if it maybe now gets more complicated, and then the person wants to probably go to an hospital to get proper check. Like I said earlier, so some can be viral. Most of those viral ones the body would easily get over them easily. And then sometimes when it maybe becomes more severe, like when you begin to now have very severe sore throats that you find it very difficult swallowing, very difficult to breathe. Yes, so sometimes they can be difficult in breathing, and some people find it very difficult to breathe. They can hardly even take in air or even take something out of the take air out of their nostrils. So then it now becomes very severe. Maybe the nostril is completely blocked and all of that. Yes. So, but on a general scale, so some things that can be done to reduce the impact of this infection could be maybe just taking lots of more fluids, right? Like we explained earlier, because of the dry air, right? The mucous membranes are dry, especially with this season now. I'm trying to attribute it to this season that we are. The mucous membranes are dry and all of that. There's less humidity in the air we breathe in, right? So because of that, everything is dry. There's no moist anywhere. So staying hydrated would really do a lot of good for helping people to get get relief over the period of that infection. And taking a lot of rest could also help, right? Because the body will get to recuperate and overcome whatever it is at that period of time. So these are some of the things that one has to look out for, right? So when you feel that it's already getting to the point of difficulty breathing, or it's already getting to the point that the person is having very difficult swallowing something, so it might be a bacterial infection that would need some level of diagnosis. Yeah, so it brings us to whether we can diagnose by ourselves or you have to get to the hospital to diagnose.
And I thought you were going to get into it already.
Okay, so if it's for um some of the general symptoms, like again, most of these infections that we're talking about would have general symptoms, very similar symptoms. And some of the times you might not be able to specifically pinpoint which exact infection the person has, right? So because the common cold, the person will probably have a fever, the person will have some kind of sore throat, the person will have maybe cough, yeah, of course, and then all those kind of things. The same thing would happen in some other cases. Sore throat would also be attributed to laryngitis, like I said, and epiglottitis, like I said earlier. So some of these things are similar. But when you see that it's spanning more than expected, the time at which the person is already infected is longer than expected, and you begin to, okay, maybe want to probe further, maybe after even using over-the-counter medications like maybe some pain reliefs to ease the fever, to ease the sore throat, the pains from the sore throat and all of that. And the person feels like it's not getting relief, he or she's not getting relief. Yeah, so the person might want to now go to the hospital to get proper diagnosis to understand what exactly is the situation. Because so sometimes it can get so bad, maybe for instance, epiglottitis can get so bad that the airways is totally blocked due to inflammation. So when epiglottitis occurs, it's as a result of inflammation of the epiglottis, right? And when this inflammation when the swell gets so much, it can get so bad that it completely blocks the airway. And then the person is like kind of choked because the person cannot, literally not
Wow.
breathing. So at that point, you know that, okay, yeah, no, this is not an home thing anymore. I need to get to the hospital to get proper diagnosis and, of course, proper treatment.
Some of the things we do at home, like the a steam that we do to our face, or maybe taking vitamin C and all that, or ginger and garlic mixture with lemon and the likes and honey. Does it help, or there's no point? It would just, I mean, if it's a based on what you have mentioned, there's a severity level. If it's not that severe, but we need to do all those, or just take a lot of water, you'll be fine.
Yeah, it does really help, right? It does really help. But as much as we want to do the steaming, yeah, so again, a person has to be very careful when it comes to steaming because you don't want it to go the other way and then the person experience some level of stimulation that affect the brain, right? So in such case, better still, advise taking of warm water, right? You're just trying to give some level of warmth to the upper respiratory tract. Yeah, so maybe I forgot to explain that the upper respiratory tract also helps to warm the air that we breathe in. So the air that we breathe in is being warmed by the upper respiratory tract before it goes down the lung. So there's some level of warmth that is needed at the upper respiratory tract. So maybe doing some warm water, warm tea, maybe with addition of the lemon that you talked about, honey, all those things really help because they are medicinal, of course, right? Of course, lemon has citrus that can help in stimulating the immune system. And remember, we said there is a part of the immune system in the upper respiratory tract. So this will do a whole lot of good. Taking of ginger, they can also help to relieve the symptoms. Again, so after doing all of these things, right, in some matter of days, 2 weeks, you feel that the person would naturally, the body would eventually get to fight off this infection and the person would get to be all right, right? So it's when it now elongates and it becomes more severe than expected, and the person wants to probe further by getting to the hospital. And maybe I need to even say that we should not just easily jump into using medications like that, especially when we now know that some of these things are self-limiting and the body can get over it very easily. So maybe when next time you have a common cold or you have a cough or a sore throat, you don't want to just gulp down one medication just anyhow. Maybe at most, maybe just some pain relievers, just to help ease the pain would do. And with addition of all those warm water with lemon, some drop of lemon extracts, right? Maybe some honey in warm water. They have a lot of impact in relieving the symptoms of upper respiratory tract infection.
I'm shaking my head because I know someone who was in those shoes and the person went to the pharmacy to ask for information and direction, a big pharmacy, popular one at that. And the long story cut short is that she was given antibiotics.
Well, was there a test done before she was given
Nope,
antibiotics?
there was no test done.
So we are playing with ourselves because it will bring me to talking about antimicrobial resistance, and our world is suffering. Our world is dying if we are not careful about using antibiotics. So like I said earlier, so there are some that can be bacterial infection, but how do you dictate? So when we know that the general upper respiratory tract infection are viral and they would get off the body themselves, right? It is when they don't get off the body that you now begin to look for, okay, let us diagnose properly what exactly is the situation. Then you are now able to say, okay, maybe it's bacterial. So it proves to be more stubborn and it's a bacterial infection of the throat, for instance, right? So when some people have streptococcus infection, right, it's a bacterial infection of the throat, and then they need to get to the hospital to get maybe swab from the throat to test whether it's actually a bacterial infection. Then you can now use an antibiotics. I mean, that's when it's more reasonable to use an antibiotic. But if not, why just use an antibiotics? Knowing, I think knowledge is key. So when you know that these things are not so difficult as that, yes, they can be discomforting, like we said. So pain relief, little pain relief as much as acetaminophen can help, right? Some ibuprofen can help. Just little pain reliefs like that can help to suppress the pain that you are feeling, maybe fever, whatever it is that you are feeling. That would do rather than just gulping down an antibiotics.
I'm holding my anger in because this is supposed to be a reputable pharmacy chain. But curious, a little digression, not so much of a digression. How many times you have to abuse? Abuse being you don't have to take the antibiotics, but you took it. How many times does that need to happen before you grow resistant to it?
Well, it's a gradual process. It doesn't just happen, right? So antibiotics are in different variations, right? We have them different aspects with regards to different infection that occurs in the body. So over time, right? And then it's not even just personal. So I don't know if I've
Mm.
explained it, so maybe I get to tell people that it's not just even personal. So personally, I find it very difficult to take drugs. I'm an health person, but it's only of very extreme conditions that you find me taking drugs, right? So I might not abuse drugs, I might not abuse antibiotics, but some other people abuse antibiotics. But when I will not eventually come down with certain infection, right? If at all I do, yeah. So I would probably be infected by the new strain of resistant infection that's happened as a result of the abuse that some other people have used, that innocent me don't know about. So when I'm now using the normal antibiotics to thinking to cure the particular infection or the particular ailments that I'm currently experiencing, I'm now finding it difficult because those things are not working for me. Unfortunately, there are new strains of microorganisms that are being transmitted all over the place because of other people resistant. So again, it's a thing that happens, not just, it doesn't just happen, it's over time, and it's a chain, right? It's a long chain that occurs, and it might not even be attributed to one individual person. Maybe I've not abused drug maybe more than once in my life, right? But other people have been doing, and I can get affected.
Please stop abusing antibiotics. Stop abusing anything, any drug whatsoever, because as you have heard now, it's not just about you, it's about others as well. Thank you very much for your understanding. On WhatsApp, Josiah says, "Good morning, doctor." Ooh, doctor? Is it healthy to shave the hair strands on our nostrils? My barber usually shaves mine. I don't used to bother, but your mention of it makes me curious.
Okay, yes. So again, the air in our body generally, they have protective functions. Like I explained earlier, they protect the body from microorganisms from getting easy access to the body directly. So imagine the air strands in our nostrils were not there. It means that everything we inhale just goes down to the other part of the respiratory system and then down to the lungs directly. So the air helps to filter. So having filtered from the air at the nostril, right? The mucous membrane also filters before the air goes down the lungs. But when the air becomes too much again, yes, so there might be need to shave a little, right? So I tell people shave, but maybe not shave completely. Don't shave completely because they have their reason. There's a reason why the air is there. So it has a purpose, it has a function that it is playing. So you do not want to shave completely. But again, if they get too much, they can now trap microorganisms that will not even now leave the nostrils easily, and they will now stay longer than necessary and begin to affect the nostrils. I don't know if that explains what the person is saying. So if it gets too much, they will trap microorganisms that will stay longer than necessary, right? And then they will begin to play their dangerous work in the respiratory tract.
Okay, simply put, everything on your body, in your body, is there for a reason. Even though you might not understand why it's there, but it's there for a reason. Two, balance is key. Make sure that you do not have a forest in there. Trim and have just the normal level that you need to have. Thank you very much, Testimony. It's been a lovely time with you. And now you've been nicknamed Doctor, or at least given the title Doctor.
Well, maybe very soon I will have to begin my PhD so that that doctor will compliment it.
All right, it's been a good chat.
All
It's
right. Thank
always
you so much.
enlightening. And you can always go back to this on YouTube because we have been streaming live on YouTube. Once you go to our YouTube page, you will see the hashtag SoulFood981, upper respiratory tract infection. And my guest has been Health Educator Testimony Adeyeye. I look forward to another conversation with you. Maybe in the new year, we talk about more things and educate more on the different things so that people can make better health choices. Yeah.
Thank you so much. Thank you so much for having me. It's a pleasure to be here again.
I know you're not active on social media, so there's no point saying, what's your social media handle? Yeah. So let's just leave that.
Thank
All right,
you.
now, thank you and bye. Have a lovely morning.
And you too. Wonderful weekend.
Thank you. Okay, so we're done with soul food for today, and we continue with the beautiful music on Breakfast in Bed on Smooth 98.1. You know that the show never ends, or at least doesn't end till 10 o'clock. So we are here together with the sweet, sweet music that is characteristic of the Love Music, Love Life radio station. My name is Oluwaseunis. Mind and the rest will follow. Yay! Thank you. Start with figuring out what does health look like for me physically, mentally, emotionally, and work
really hard on
All right.
healthy mind.
Have a
healthy
swell
body,
weekend. I hope you can go back to sleep.
soul food.